If you're struggling with lower back pain or tightness in the front of your hip, people are commonly going to tell you to stretch your hip flexors. Just like this, doing your lunge stretch over and over and over again. When, after only a couple minutes of doing this stretch, you're just back to that same pain and that same sensation you were 5 minutes ago. So what do you actually need to do? Here's what no one's actually telling you. It's not just tightness through our hip flexor, it's weakness, and we need to strengthen this muscle through specific exercises. But here's what nobody's telling you. Your hip flexors aren't just tight from sitting in a chair. They're also weak, and we need to train them with intensity. And stretching a weak muscle is only going to create a vicious loop of more and more pain. The hip flexors, mainly your psoas and iliacus, are predominantly used to pull your knee towards your chest, like that, stabilizing your lower spine and transferring forces from your upper and lower body. When they're weak, your body starts to compensate, doing things that aren't necessarily ideal or structurally sound. So your lower back takes over, your glutes tend to not be able to do their job either, and you get a lot of lower back pain from these muscles just overworking and constantly being called to do a job they weren't built for. So what do you need to do? Before we get into the fix, we're gonna test out your hip flexors. This is called our chair test. Before we get into the fix, let's do a quick test to see if this is actually an issue for you, which it most likely is. We're gonna sit on the edge of a firm chair or a box with our legs at about 90 degrees. The next thing is we wanna make sure that our pelvis is turned forward and we're not just slumped down into our chair. Think perfect posture. You should kind of feel your sit bones rolling behind you in this. Then we're gonna get nice and tall through our spine, lifting one leg up. From here, you should feel pinching and tightness and honestly, maybe some discomfort through your hip flexor or the crease of our hip right here. Hold this. The goal is to hold it for 60 seconds without shaking or bad posture or cramping into this position here. This is a lot easier than nice and tall holding this position. If you're under 15 seconds, you're most likely someone who struggles with chronic lower back pain, and that's a sign that you need to work on the strength of our hip flexors. So here's the protocol for fixing our hip flexors and getting these muscles strong. 3 separate movements, one to open up the hip flexors, one to expose and build the weakness, and one to make it functional and strong under load. Now our first move is going to look oddly familiar to what I just talked about was the issue to start with. But there's some fine details that we need to pay attention to actually make this worth your while. We are trying to still stretch out our hip flexor, but with some intention here. So this first exercise is going to look very similar to what I was talking about in the beginning. It's our half kneeling position here, but we want to take our posture and our pelvis and be a little bit more specific with it. So we're trying to say this is neutral, tilt it underneath. That is going to automatically put more stretch on my hip flexor right here without doing anything else. One way to do this is almost like squeezing your glute, you're pushing your hip forward and then rotating that pelvis underneath, maybe crunching through your lower abdomen. Again, already feeling the stretch here. Then from there, we're keeping our chest nice and tall and lunging forward to get even more of our stretch. We need to get that posterior tilt because we're coming back from this neutral kind of rounding through our lower back, that natural position when we're sitting. Tall, rotate that pelvis forward, squeeze your glutes, drive your hip forward. Hold this posture for 45 seconds without your lower back arching and coming in and getting involved. We want to keep everything tight, rib cage, tucked down, hip forwards. Then we'll switch sides, same position. We're pushing our pelvis forward, kind of rotating underneath us. Then we can start with our lean forward, driving our hip. Hold for 45 seconds. Get a nice stretch through our hip flexor right here. And we'll go into our second exercise. To our second exercise, you should be familiar with this as it was our test to know that you needed this exercise. Again, we're gonna sit on the edge of our chair, good posture, trying to rotate that pelvis, get our body nice and tall. We'll lift our leg up, holding it as long as we can. If we're front on here, we want perfect posture, pelvis is rotated, nice and tall through our spine. Lift that leg up. It doesn't have to be the biggest lift. We're holding this, good posture, maintaining it. Leg starts to shake, it's challenging, maybe a little crampy. That's okay, that's normal, it's expected. We're working on these muscles in ranges of motions they're not used to. Make sure you are timing this so you can reference how long you're able to hold it with good posture, keeping your leg at about parallel or higher. Keep that going. Once you fail, once your leg falls, you start to shake, you lose your back, your posture, whatever, time that, rest, go to the other side, and try to replicate it. If you're unable to replicate it, go to the other side when you do it your next time and shorten it so that either side is not getting stronger than the other. Again, our goal here is 60 seconds. That is a good threshold to have adequate long-term strength within our hip flexors. Our last exercise of today is working on the functional strength and stability through our hip flexors and integrating it with our general hip joint. So holding on to something, the goal here is not to test your balance, so hold on to something to make sure that you are not constantly swaying back and forth and falling. We'll stand on one leg, anchor this band with that foot that's staying down on the ground, other leg is coming up. So it's important here to keep your toe up, otherwise if you point it, you run the risk again of that band coming off. Drive your knee up, trying to keep knee and hip at 90 degrees, then right back down, and again, knee, hip, 90 degrees. We're gonna go up and down in our Psoas march. We're driving that knee up, out, 90 degrees here, 90 degrees here, then down. If we're here, my hip flexors are not working that hard. Up and out with our leg. The further you kick that band out, the more that hip flexor muscle and those psoas muscles are gonna have to work. Don't let it stay here. Again, it's still gonna roll off and you're not really getting the benefit. So kick that foot out. That's why we want that knee joint about 90 degrees, up and down. You will also get a nice pump in that other hip, just more stability for everything in your life. Here's why this matters more than just hip tightness. Weak hip flexors are related to low back pain, poor athletic performance, poor posture, and knee issues because of how the kinetic chain works and forces come up and down our body. Most people are spending hours seated in a shortened position with our hip flexors. A shortened muscle that's constantly going to feel tight. If we're not also strengthening it and putting it through load, then it's just constantly going to fight that urge to go back into its tight, shortened position. So here's your homework. Test your hip flexor using the chair test. Are you able to hold that leg up with good posture and good positioning for 60 seconds? If you are, that's great for you, and there may be some other underlying issues with your lower back if you're struggling with pain. If not, that could be a big culprit for the reason why your lower back hurts, your knees hurt, and you just constantly feel that tightness through the front of your hips. If that's you, use the 3 exercises that we highlighted today to both lengthen, strengthen, and create functional stability within that joint and within those muscles.